somebody that I know who wrote in saying, what about adding honey or certain things in that might help with hay fever? Or is there any kind of things that they can ingest in foods that's going to help on that? Or is that a complete myth?
So the idea is a good one. I happen to love honey myself, so I'm not.
I love honey.
But and again, this is where we get into quantities. So most biological processes are follow what we call a dose response curve. The more you give of the treatment, the more it works. Of course, up until you start to reach toxicity and side effects, which you don't want. So you need to find the right balance. The honey is a great idea. The problem there is the levels of pollen are too low, way too low. And if you think about the dose response curve, you're right at the left side, at the lower end of it, and you're not really achieving enough. And in fact, there were studies many years ago, 50, 60, 70, 80 years ago, using very, very low dose immunotherapy. And this can be done by injection or just giving it as a tablet or liquid under the tongue, and you absorb it directly. And this is a dose-related process. So honey, unless maybe you're eating bucketfuls of honey, which might not be
I hope they're
too
not.
good.
As a nutritionist,
that might be not too good an idea, not something I would recommend. But no good evidence that it works.
Okay.
The idea is a sound one.
Yes.
But it just, would be a bit like saying, let's give a vaccine, let's give a COVID vaccine, but let's give 1/100th of the dose, the protective dose. You're not going to get protection.
Yeah, well, I think that's going to be really helpful for some people that might be thinking it could be helping and then feel very frustrated if it doesn't. So setting that straight is actually really helpful. But there are other ways. So as you just said, there's the immunotherapy way where people can go and get an injection over 3 years. So there are methods, but maybe the honey one's not the most.
They are, and they're pretty straightforward. And more, although subcutaneous injection immunotherapy is excellent, sublingual immunotherapy, which is easy because families don't need to come in every month for an injection. They can simply take the medication by themselves at home daily, under the tongue. Takes a minute, and
it's much easier.
Very successful. It's a gradual effect over 3 years, so people have to persist with it. But the result is generally excellent. Doesn't work for everybody, but it works for the majority.
Well, I'm really pleased that we touched upon that because that was such a big question that we had from our listeners. And I do know that so many of people in my life suffer with hay fever. So it is a real, it can be very problematic and hard for people to deal with.
And of course, just to interject here, with the respiratory allergy, a key thing is identifying what is the allergen. A lot of people think it's dust mite allergy, but it could be the dog or the cat at home. And they don't realize that. And every time they leave home, they feel much better. Come home, they think it's because they have a dusty environment. It could be the cat or the dog. It could always be something else. So you actually have to identify the allergen on testing and get a really good idea from the history that this allergen is responsible for the symptoms. Because if you use the wrong allergen, so for example, if you have, one were to have hay fever due to grass pollen in May, June, July, and I were to treat that person with tree pollen, which causes problems in February, March, April, I wouldn't be curing that person's hay fever. It's a bit like giving the wrong antibiotic for the wrong infection, and that doesn't work.
Absolutely.
So careful definition, both by testing and by history, is really essential.